Thank you very much, ladies and gentlemen. We are going to try and make it brief because of time, but we'll try and cover most of the highlights, the challenges, the opportunities, and especially with after the COVID-19 pandemic, we are going to try and see what are some of the challenges and opportunities that we can cover this afternoon. Thank you very much. I'll dive straight into the questions. Welcome on stage, panelists. We're just going to start with one by one, you describing your company goals and aspirations in the health sector in Africa. And while at that, also tell us how your organization changed during the COVID-19 times. What were some of the gaps and opportunities that you have seen with the COVID-19 pandemic? And what are we looking at in terms of us delivering our goals in ensuring sustainability? So basically introducing your company and telling us some of the changes that happened during COVID-19. And I'll start with Lisbeth.
Thank you for the opportunity to be here. My name is Lisbeth Charana. I am the superintendent pharmacist for Nyabero Pharmaceuticals. Many of you, or some of you, might be familiar with Nyabero. We're an online pharmacy. We're more known for the online pharmacy, but we actually have three arms of our business. One is that we contract manufacture out of the country some generic brands of medicines, and we come and distribute them locally. That's B2B. Then there's the online pharmacy that most people are familiar with. And most recently, we have started offering telehealth services. We have registered a clinic and gotten telehealth licensing, so we're able to do online consultations and manage the prescription or management of patients end-to-end, from consultation to delivering their medication. In terms of COVID-19, Nyabero started in 2017. And the embracing of technology as a place to order your medicines was not quite immediate, but there was quite a higher uptake post-COVID or during COVID that we have seen to continuing to grow to date. So, of course, the challenge is, as we all know them, people could not go or were too scared to go to medical facilities. A lot of businesses also maybe were not open, and people did not have ways to access their medicines, especially if you have chronic illness, because incidence of acute medicines may or may not have reduced, but the uptake of healthcare definitely reduced during COVID. With that, more people were now willing to explore ordering their medication online. So that definitely improved the uptake of the service. And one other opportunity that came from that was that apart from being able to fulfill just the prescription, some people call you and you cannot really assist them because the medication they need needs a prescription. So with that, we saw an opportunity to offer consultation services and have a medical team as part of the group, so that we meet that need of consultation that is online. And then now, if we need to do any laboratory testing, for example, we work with lab partners that go to the client or patient, collect samples, test, give results, and then prescription can be done, and we are able to deliver the prescription.
Thank you. Antony?
Thank you very much for having me this session. My name is Antony Jaccodul. I'm the CEO and Chief of Science at Keton Group, and also a Director at HeaalthCare Federation. So basically, Keton Consulting deals with, in the space of laboratory medicine, especially knowledge management and also hardware management. So knowledge management, we majorly focus on trainings and capacity development of pathologists, laboratory scientists, and also laboratory technologists. So we do trainings on ISO standards, that is ISO 5299, and allied trainings on things to do with method validation and many other stuff. So we also have an arm for external quality assessment services, whereby we ensure that the tests that you get when you go to your laboratory are actually what are expected in each and every part of the country through what we call EQA. We're also in the space of clinical laboratory equipments. That is, we supply and sell molecular equipments, we do immunoassay equipment, biochemistry, hematology, and medical consumables. So we're also a young and agile company. We started like 7 years ago, and we've grown in leaps and bounds. So we have a branch in Uganda as well. We also have a space in Tanzania. So just to go back to the topic on how COVID-19 changed how we did healthcare. So COVID-19 came as something that accelerated our innovations, because I remember when that was just starting, not everybody knew what lab was all about. And all of a sudden, laboratory science or laboratory medicine was at the space to save the humanity, because you really needed to know whether you're testing positive or testing negative. And for the first time, I think many people knew what PCR test is, because initially nobody knew, especially the public. So PCR testing came, and everybody knew now. I could see arguments in TV whereby people are wondering, what is this PCR issues all about? But at the background, we are struggling with the supply chain issues, especially items that are used to collect the viruses, especially the viral transport media, the swabs for nasal and oral swabs, because at that particular time, there were only two big companies in the world. One was based in Italy, and the other one was based in the US that majorly manufactured this kind of products. So we could get frantic emails and calls, and they could not be able to supply Africa that particular time. So what did we do as a team? Because our company is more of made of guys who are technical in our areas of expertise. So we went back to our books, and we could be able to start doing one or two things to do with the manufacturing, or just doing some mini manufacturing of viral transport media. And actually it worked, and we were able to help some of the few counties that particular time before we could be able to now go the other side. So this one accelerated the issues of innovation in Africa and also in this particular space. And I think currently we have some companies that are now venturing into this particular space to be able to manufacture things for ourselves, because I could hear presentation earlier on the dairy board and things. Other guys who are manufacturing stuff locally here. If we're able to drink our own milk, we're able to take our own meat here. Why should we import diagnostics from somewhere else? If you have the science, we should be able to be supported to be able to move in that particular front. So that is where the thinking, especially in terms of IVDs, is going towards. So that is just the summary from myself.
Thank you, Antony. Lucas?
My name is Lucas, Dr. Lucas Nyabero. I am a husband, a father, a clinical pharmacist, and I'm a member of the KCM and also the CEO of Pharmaceutical Society of Kenya. Pharmaceutical Society of Kenya is an organization, or is a society is a professional society for pharmacists, and we do advocacy, litigation, things to do with litigation, membership welfare, and also making sure that the laws that are there advance pharmacy. We strive daily to provide effective, efficient. We want to make sure every Kenyan gets effective, efficient, safe, quality, and affordable health pharmaceutical care. And I'm saying pharmaceutical care for a reason, because pharmaceutical care is not drugs. Drugs are drugs. You can take the drugs, but how you take them, what are you taking, what are the side effects, what are all those other things that go towards making sure you will feel well after you take what you're taking. So when the pandemic happened, we were not quite, there's a lot of things that we were not quite ready for in terms of policies. Everybody, I think every industry struggled with this, because it was something new that we had never thought of or planned for. And what we had to do, like for Pharmaceutical Society of Kenya, is we started doing trainings. We started informing our members how to make sure they stay safe, how to make sure our members, that the patients stay safe, and what are some of those things that needed to be done to make sure that even the meds you're taking, the prophylaxis, all those things. This story of having antibiotics for viral diseases, and that's why we're having issues with antibiotic resistance. So we had to step up the training part of things. And we're in the process of going further, knowing that during that period, we were stretched so much as a healthcare system that there's some things that now pharmacists have to do that they didn't do then. So the question is, how do we then move and ensure that the guidelines, the laws, the policies support that kind of care being given to our members? And the whole goal is making sure every patient gets the best they can. Thank you.
Thank you, Dr. Lucas. John?
Thank you. Thank you so much for inviting me to this panel. My name is John Keane. I run a company called Apomedix. We deal with in vitro diagnostics and life sciences. So our slogan is basically sustainability in IVD, in vitro diagnostics, and life science business. Our core area is basically bridging the gap between the market barriers that hinders the go-to market and accessibility for quality healthcare, as well as realignment of not point of care but primary healthcare access. Those are our areas of advocacy and focus and consulting work that we do. During the COVID pandemic, this came in at a very interesting point because everybody who is seated here in this room, apart from the healthcare professionals as well, were equally affected by the supply chain disruption that happened. And in my experience, supply chain, especially when you're a net importer like ours, of commodities and tools for healthcare and life sciences, with very limited manufacturing, and even with the ones with manufacturing that had to buy, products as raw materials, you could imagine the weather was one of the things, and then the COVID pandemic was another. One of the breakthroughs that we saw in the diagnostic world is because of the restrictions of movement, people were not able to access the medical care. And this brought in a fundamental question of what the gap between primary healthcare accessibility and the main referral facilities, and what needs to be done in between. And that's where we come in. We came in with tools to bridge in that gap. In some countries like Uganda, they decentralized provision of diagnostic services where you could call in and somebody come at home. And we are still moving that journey because we believe the opportunity provided by COVID-19 can accelerate universal healthcare access and healthcare coverage. And the only way to do that is how do we bridge that gap of primary healthcare access in a continent where you have 75 to 80% of the population still in rural areas with less infrastructure. So COVID-19 was a springboard to us. Thank you.
Thank you very much, John. I think with that, we have an idea of the mix of panelists that we have. And at this point, I'd like to dive straight to the private sector role in facilitating the growth of healthcare sector in the African countries. So I would like to pose this question to Antony Jaccodul, again, as you're going by your role as one of the directors of the Kenya Healthcare Federation, and knowing the role of Care Chief in bringing the private sector together to advocate for some of these challenges that face the health sector. What is the role of private sector in facilitating the growth of healthcare in the African countries?
Thank you very much, Leah, for that question. I'll start by saying that, as we normally say in our space, that there's no private patient or public patient. A patient can either go to a public hospital or a private hospital, depending on the situation. Because most of the time, when you travel out of the Nairobi or in the rural area, you can get sick, you go to the next health center, and you expect to be attended to, as much as you use private facilities in Nairobi. So the role of private sector in ensuring that quality of care and also accessibility of care and affordability of care is done. We have always done this through Kenya HeaalthCare Federation, which is a sector board for health for KEPSA, Kenya Private Sector Alliance. So this was born out of the need for government and the private sector to be able to sit on the table and see how the healthcare space or the healthcare business is run in the country. So through KHF, we normally have the ministerial dialogues, whereby every quarter we meet the Minister of Health and also the team at Afya House just to discuss the bottlenecks in terms of what really ails healthcare. Because under KHF, we have about 6 pillars. We have the quality committee, we have supply chain committee, we have the ICT committee, we also have HRH committee. So all these pillars mirrors all the departments that are in the Ministry of Health, so that when we go sit on the table, we are able also to tackle each and every issue that affects healthcare. And I think this has improved a lot of conversation and also a lot of partnership between us and government in terms of improving the regulatory framework. Because the government owns the regulation, and if the regulations are not made easier for the private sector to thrive, it means that we will not be able to improve the quality of care. Because the government is enabler in terms of business, especially through healthcare policies that are passed. So you realize that even the healthcare laws that are passed in this country, we are consulted heavily with the Ministry of Health, and we are able to be part of the technical working groups in that particular space. And through that, we are able to enhance business. And not to say that there have not been challenges. There are still challenges, especially to the supply chain, especially items to do with IVD space. I think we still have those challenges, especially with the regulation red tape and all these particular enactment of policies that at times hurt business. So our solution as a board most of the time is to engage and continue to engage the government in areas that will improve business and to bring down the cost of health. Because I normally believe that we normally need more health for less money. We should be able to have more health for less money, not the vice versa. Because if the cost of medicines are high, if the cost of tests are high, it means that the overall space in all these particular costs are normally passed to the patient in the bottom of the supply chain. So those dialogues are something that we continue to have with the Ministry of Health as much as possible.
Thank you, Antony. You've mentioned a few challenges like regulation and policy enactment of policies within the private sector, trying to work with the government. Dr. Lucas, maybe you could just add on to more challenges that the private sector players face in this regard. Considering your capacity as CEO of PSK, I believe you deal a lot with some of the major challenges in the private sector.
Yes, that's very true. We do have some challenges, and I think one of the major challenges that we have, and this comes back to sustainability, is the data we have on prescriptive habits. We are not so sure. We don't have good data to know what's the average adherence compliance for a patient in Kenya. If they have a typical Kenyan who gets 30-day prescription, will they fill it every 30 days? Will they take it every day? We don't know that. We don't know. As a result, you can't forecast. As a result, you can't plan. So when we are planning, the data we are using for planning is not as accurate as it should be. And as a result, sustainability suffers because do you buy more, do you buy less? If you buy less, you'll pay more to get more in. If you buy too much, then you have to throw away a lot through expiry. The other thing too is market sizing, which also helps with that same thing. The challenge of market sizing. So we are talking and we are working very hard to increase and actually build local manufacturing of pharmaceuticals. The question is, how much of what should we be making? As a result, what is the investment and what is the ROI on it. And these are some of those interesting issues that we have to deal with. And I think the best thing is, how do we best sustainably understand the market size, and also how to understand the market size and the market behavior so that we can make smart, data-driven decisions on what we need to have, and that can help with a lot of the challenges that we go through.
Thank you, Dr. Nyabero, for that elaboration on challenges faced by the private sector. I'll go to the next question, which is about new technologies in enabling the further growth of the health sector. And I'd like to post this to Ms. Lisbeth Maidawa. You mentioned that Maidawa operates in 3 arms, and I noted the online pharmacy and the telemedicine. What is the role of new technologies in enabling further growth of the health sector in Kenya and in Africa at large?
Thank you for that question. In terms of new technologies, I'll pick just one of the things that Dr. Lucas has mentioned. It's very hard to do, for example, demand planning when you're ordering medical supplies without data. Technology, in this case, can, number one, offers us a good record keeping, therefore data to work with. And with the technology at the moment, you can use it for predictive analysis, for example. So then you know that this is the kind of, for example, stocks that we need to keep, and you're able to order optimally to buffer yourself from the price challenges, and also to protect yourself from overstocking and leading to too much, to destruction of expired products. The other thing is that with technology, we are able to give more patient education. That means patients are able to be more in control of their health and their health outcomes. They know what to look out for. It enables health-seeking behavior also. It improves it. Therefore, again, this will just lead to better health outcomes. And aside from the supply chain, there's a lot of diagnostics coming up. There's continuous glucose monitors, and this is some of the health technologies that are coming in, again, to help with better patient management, better management of conditions that we are now facing, especially chronic conditions. And yeah, we are able to leverage this to have better outcomes, and also better outcomes health-wise, and also better outcomes in the supply chain and in terms of wastage to maintain sustainability.
John, going by the new technologies that Maidawa has highlighted, what are some of the technology gaps that we are facing that are hindering the realization of sustainable local supply?
Thank you. First of all, thank you. I mean, having Maidawa on the panel is good, because there are practical examples of what we would call telemedicine in reality. If you look at Maidawa model, they bridge the gap between consultancy services, and they've also bridged down the gap between the customers and access to medicine. And I think at the moment they're also looking into laboratory decentralization. So to answer your question, improving on what Maidawa is doing, one of the biggest gaps that I find is digital literacy. That's one big gap, because to have a good benefit to the last person, which I would call the last mile patient in my village, to be effective, the whole idea of telemedicine, for example, is to bridge the gap between distance of, brick and mortar facility and the services itself. So one is digital literacy, that is still on a low base and is more predominant within the urban setup compared to the rural majority. That's one. The other problem that we see is especially in the private sector, is affordability of the infrastructure itself, to put it together, that infrastructure. The regulatory framework around that is prohibitive. The desire and the push between, the relationship between the private sector and the public sector to drive one common goal. Still, you find that people are still working in silos, and that kind of bring, delayed response to better patient outcomes. The third thing is affordability of the tools to the business. For example, Jaccodul would tell you that to have a proper infrastructure in terms of tools of diagnosis to be used in a decentralized setup, that cost is prohibitive. And that brings to the point of supply chain. Because I remember a couple of years ago, a simple thing as culture media that was being tried in this country, which would have reduced the cost of microbiology testing and also reduced the carcinogenicity of powdered media, is something that has been a pipe dream for now 12 years. And you can imagine the opportunity gap that is in that space. So also, to address that particular concern, there's need for consulted efforts between the private sector and the public sector, knowing one thing, that the tail end of it is a patient, and that patient, it doesn't matter whether he's the president or he's the most poor person. At the end of the day, when it is malaria, it's malaria, hypertension is hypertension. So basically that's what I would say.
Okay, thank you. Those are quite a number of technology gaps that we can take note of. We will have questions in a few from the audience. So I want to ask the last question, and I want to pose this to Dr. Nyabero, and maybe Antony, you can back this up. What are some of the possible opportunities for government policy directives, not only in Kenya, but also in the region? You realize that as a region, we need to enhance healthcare, not just in Kenya, not in East Africa, but in Africa. What are some of the opportunities that we can use, some of the trade deals that we can use to promote trade and even medical tourism in Kenya and East Africa?
I don't know about the tourism, but I'll say one word: harmonization. Right now, if you come up with an agent that you design and prepare in Kenya, if it goes to Tanzania, it has to go through the regulation there. If it goes to Uganda, it has to go through regulation there. So it doesn't really, although there is the East African communities working on something, Africa is, I think AMA is one of those ones that's going to come to harmonize that, such that anything that is designed in Africa is designed in Africa. It passes AMA. If it goes to FDA, it doesn't have to go through FDA rules or CE. How do we harmonize all these 54 different countries such that what we do, how do we harmonize the training? How do we harmonize the caregiving? How do we make sure that if you get on a road trip and you get stuck in Ghana, you'll go to the hospital and they'll treat you the same way they treat you here? How do we harmonize that? Because if we do that, the possibilities, the opportunities for what they're calling even pool procurement. Think about it. If we all, the 1.3 billion people in Africa are treated the same, so I'll say one thing and then we'll be done with that too, and then we can talk some more. You know the drug issue that people talk about everywhere? If there was no demand, nobody would sell drugs. If we don't buy antibiotics, nobody will sell them. So we should not, that's my call is to you. Don't buy them. And that will go away. Because the regulation side of things, we can talk about that. There's a lot of quackery out there. There's some other things that are happening. But the easiest way to solve this problem is do not buy it. You who's been educated about this, don't buy antibiotics without a prescription, period. And then they will go out of business.
Let me just add.
I think just right on that. When you travel out of this country, let's say you go to South Africa, you go to Dubai, you can never buy a drug over the counter. Yeah, you will see. Yeah. So don't buy it. I don't know why.
I want to add on the same what my colleague here has just talked about. It's important to note that I'm also a medical doctor by profession, And therefore, I want to, in other way, support the people who are on the ground, our patients, our clients, to the sense that you, the regulator, the pharmacies and the poisons board, the PSK, the stakeholders within the pharmaceutical industry, you are allowing these pharmacies that are masquerading around to bring these drugs to the market. And it is in that backdrop that patients walk around and go to the pharmacy and they are issued those drugs. So if you could just put a stringent measure like what she's just saying, can they just not have those drugs? How comes a basic pharmacy that does not even have registration has meropenem, has a quinolones within the pharmaceutical, has a cephalosporin stock?
Okay, so let me, I agree with you. In a perfect world, that's what you do. But where we've reached right now, the Pharmacy and Poisons Board will go around and shut down pharmacies that are not licensed. By the time they take those people, they get to the other side of town, it is opened again. Pharmacy and Poisons Board has gone to some areas where they have been chased away because they are coming to close a pharmacy because that's the only pharmacy that people think is right, and it's a fake pharmacy. So what I'm saying is, I agree with you. We can use all these tools to stop this. Here is my suggestion. As a person who's aware now, do not tell your family members, your friends, don't. On the other side, in terms of regulation and other things, it's being done. There are new things that are being tried to make sure we shut those things. Meanwhile, before that actually goes through, it's the same thing as a drug issue, right? You can't, you'll say don't bring drugs into the country. They'll get in. They will get in. But if you tell your kids don't take the drugs, that's one step again. They won't take those drugs. So I'm trying to say there is demand and supply. Here's the other, let me just screw this up completely. People go to the pharmacies because they can't find appointments to see the doctor. How about we fix the whole healthcare system such that when somebody's not feeling well, they can be seen the same day and they get what they need at a good, reasonable, affordable price.
Add more rules.
Thank you.
Add more rules. One thing, drugs and food are very critical things, okay? You can't go to a supermarket, you find something expired on the shelf. For example, milk, for example, yogurt. Immediately they expire, they are taken out of the shelf. You can do that to those pharmacists. Put more measures, put more rules, control them, finger them, they will stop.
Thank you.
I agree with you. I agree with you that we need to do that. But as a non-pharmaceutical guy, I would say this. One of the key rules is stop Googling your symptoms and your children's symptoms. And unfortunately, this happens a lot in urban setups. You find multi-resistancy at a lower base in the rural setup compared to in the town setup. Town people love to Google stuff. And when they Google stuff, if I am a pharmaceutical manufacturer, I do my demand planning for the market. I look at, okay, how many antibiotics will I sell in the next coming year? It is immaterial whether you're going to buy this over the counter, right? But if you keep on Googling this stuff and you go back to your pharmacy and you get without a prescription, whose fault is it at the end of the day? Absolutely. So there are several regulations in place, both food and beverage industry, pharmaceutical industries, but the behavior is in us as a people. That's where the problem starts.
Thank you, John. Thank you very much, our audience. I'd like to take this opportunity to thank the panelists. Apologies, we will not take any more questions because of time, but you can submit your question and we can handle it behind the scenes.
It's okay. I'll see Dr. Lucas after this.
Okay. So thank you, John Keane, Apomedix. Thank you, Dr. Nyabero Lucas, CEO, PSK. Thank you, Antony Jaccodul, Director, Founder, Keton Consulting, and Director, Kenya HeaalthCare Federation. Thank you, Lisbeth, Pharmacy Operations Director, Maidawa. We are happy that you made it to this panel, and at this point, I'll hand over this to my colleagues.